Hi, everybody, and welcome to Masterclass number 4, Nourishing the Future, How Food Access, Strategic Partnerships, and Policy Collaboration Can Transform Health. And this masterclass is provided by Pandora Redmond, who's a registered nurse. Pandora is the founder and director of Hearty Helpings Food Pantry. And this is a faith-driven nonprofit who serves food insecure families, seniors, and disabled individuals across the Delta. She has more than 22 years of experience in community health. She leads with compassion, with resilience, with a commitment to restoring the dignity of individuals through food. Her leadership continues to uplift and inspire people. One of the reasons, Pandora, that I'm excited you're here is because I know that the mobile food pantry that you operate and the way that you feed people, we have hunger across our nation. And so the work that you're doing is going to inspire people, but it's also going to provide them with a model that they can implement in their own communities, right?
Yes, right.
And Nourishing the Future, well, here's what you're going to talk to us about. At least this is what I'm expecting. You're going to talk about how food access, how cross-sector partnerships and policy engagement are transforming health outcomes in food insecure communities. And you're going to, again, focus on the Delta. But what happens in the Delta happens in other communities too. Also, you're going to talk about how mobile food pantries and delivery services can be provided to give people access to food that wouldn't have transportation, for example. You're going to be talking about delivery services and interprofessional collaboration, which are important topics, and those are important themes in this entire masterclass series too. And what I love too is that you don't leave out public policy. You're going to talk about public policy. You're going to talk about how it's important to work with lawmakers and other key leaders in communities so that we can expand access to equity and institutionalize food as medicine. So welcome this afternoon. I'm so glad that you're here with me. And why don't you go ahead and take over? All right, this is your class.
All right, and thank you so much, Ms. O'Doodley. Before I even get into what we're going to discuss today, I want to let everybody know that food, everybody has a right, a living, God-given right to food. And not just food, but to healthy food. And that's where we come to this point, because food is health, good health, food is life.
It is.
So I wanted this to go with my learning goals for today, and hopefully I can explain it where it can be duplicated. Completion of this class, they should be able to, like I say, duplicate. First of all, the first goal I wanted to express is examine how food insecurity directly contributes to chronic illness, chronic health conditions, such as diabetes, hypertension, mental health issues. And people think food with mental health, but it does play a big role in mental health. Also, I would like to explore interprofessional and organizational strategies that promote. We have to work together. The Bible tells us that, where two or more gather, he'll be in the middle of whatever's going on. And it takes more than one person. It takes a village. It does to feed and help our neighbors. So we're partnership. That's the biggest thing I'm saying. We have to partner, because I can only go so far. But if it's just like baton, passing the baton in a race. When I reach my goal and go as far as I can, then I can give it to you and you take it farther. So that's what partnership is about, working together to go farther. And also one of the main things is the policies. I'm gonna express how we can get to know your local, electoral official, and work from their local, and we'll go to the state level. So everyone should know whatever the progress or whatever the process is, they should know your process, right? The legal, that way they can understand it better.
I know you got some pictures in your presentation, pictures of you. Are they in your state capital?
Yes, they are.
Because I know you're not just talking about something That's a good idea. This is something you do.
Yeah,
Everything you're going to talk to us about is what you do.
that's right.
And you do it because it works.
Yes, ma'am.
And that's what we need. We need work that works. Ideas that
All right, that's correct. And it has been proven, time and time again that it works.
it does.
So I'm gonna tell you a little bit about myself and how I ended up in food pantry. I'm a registered nurse. I've really been in the healthcare field since I was 18, over 40 years. And I started as a CNA and worked my way to RE.
Oh my goodness.
But, during that time, I just knew I knew I wanted to be a nurse, but I just knew that I was going to be in the healthcare field because I was so compassionate about people. But, once I started my own business, I I just wanted to help even more. I went into the homes of the elderly people and I saw the conditions that they lived in. I saw that they were doing without. And that's in my slide. They had to choose. They have to choose. They're on a fixed income and they have to choose, am I going to eat today or am I going to sit in the house without light?
Exactly.
Or do I need to get my medicine or can I skip a day and take a pill this day? So they have to make it. Most times food is the number one thing that they do without because they feel like they can.
Right.
But, that's not healthy. And we see people every day and we don't know. We just don't know.
We don't. And I love the point that you made about going in someone's home. It's what, for the most part, people come to us, right? In our offices, in our clinics, at the hospital. So we see them in a situation that might be the total opposite of what their living situation is. This whole masterclass series is about the social determinants of health. So do you have access to safe and affordable housing? Do you have utilities that are on and working? Do you have transportation? Do you have access to food? Those are 4 core social determinants. And you just talked about all 4 of them in the same sentence, but it's your work. So
Yes, Lord. And and when you said that brought even more because we have had to address all 4 of those. If they get food and they don't have electricity, what like, if they get food and they don't have a home, they're homeless. If they're getting a bag of groceries that has to be cooked, things like that. So we provide hot meals as well. We have a soup kitchen. At one point, we were serving 150 meals a day.
wow.
And people were walking from across town just to get a food,
Oh my goodness.
a meal. They need years because you're not going to walk that far if you're not hungry. And they would sit there right there on our steps and eat.
Oh my goodness.
And, and with that, even we've seen people go in a garbage can, get food. It's just that their, situation. So we've seen a little everything. And, that brings us to my first whole question. What does hunger look like? Can anybody answer that question?
What does hungry, hungry looks in different communities. It might look a little different, but I have a feeling you've got a really good description for us.
I do.
Yeah.
And before I do that, I just want the audience take a minute and think. I'm going to give you 4 answers and you choose which one you think. What does hunger look like? Thin and visibly weak, overweight but nutrient deficient, someone who begs for food, or someone who lives in a shelter. What would you say, Ms. Garcia?
I could not separate one of those and say it's false. They all sound hungry to me.
Yes, ma'am. Are they? Well, hunger looks like an overweight person. There is nutrient, and they do look like big forms of hunger. But this person, hungry isn't always visible. Just because you see an overweight person doesn't mean that they are not hungry. And this to the cellular, are they getting nourishment? Because they could eat chips all day, but still their body is like struggling and they're experiencing hunger and malnutrition,
Right.
to a certain degree.
They wouldn't know this because master class number 8, you haven't heard, but Dr. Stephen Farrow works with obesity and diabetes. And he talked about exactly what you just said about people eating chips, having easy access to foods with few nutrients.
Yes.
And how, that just aggravates chronic disease.
It does. It does. And that's what is one of the things that trigger diabetes. Eating those high calorie foods, those fried foods constantly, no nutrition for the cell, and just goes on and on day after day, year after year. And then before you know it, processed foods, that's how some people have access to. They very seldom have access to fresh fruit and vegetables, right? And that's one of the main ways. Those are the healing, those colorful, rainbow, beautiful, those are the healing fruits, vegetables that God has put on earth for us. But the processed foods are just one of the things that exaggerates, poor health.
Certainly aggravates diabetes and obesity.
Yeah. And I reduce it as well. But those processed foods, they're so high in sodium.
Right.
And it's a lot of hidden sodium in processed, right, whole good things like that chili. So that is a beautiful thing to know, not to experience. Okay. But yes, overweight is the answer to that particular, but all of those could have easily fallen in right. Okay. And I want to just let you all know that the Mississippi Delta has some of the highest rates of poverty, insecurity, and chronic disease in the whole nation.
Wow.
It just rural. Sometimes there's not a store per mile, from the person resident.
Right.
They either have to walk or have someone pick them up. And I found out that when some of the elderly clients were coming to the pantry and they had to pay a person $10, $15 just to bring them get a bag of groceries.
Right.
And that is so cruel to me. That's one of the reasons, during our transition to what we wanted to mobilize what we're doing because people didn't have access to that transportation. And that's, like you said, it's those main things they're going to keep.
It's a cycle. It's how you break out. Where do you break out? Really.
Right. It is so true. So 1 in 5 households are food insecure, especially in the Delta.
Wow.
So every 5 households, we see one of them. And I would say 2 now because prices have gone up so high.
Right.
And then some people just can't afford to pay it.
Mm-hmm.
Okay. And I have another poll question.
All right. Let's see if I can do better on this way.
I think you did great.
Thank you.
Okay. What does healthy look like? Now, we know what we asked about hunger, but can you tell what a healthy person look like? And I give you 4 hints.
Okay.
A thin with no diagnosed illness, someone who exercises weekly, a person with a balanced nutrition, stable mental and physical health, or someone with access to a gym.
I'm going to go with C this time.
That did 100.
Thank you.
That is so correct. Most people that are active, we have to all of the mental health, physically exercise, and then eating a balanced diet. That's what healthy looks like. That's the picture of health. So we want to strive. It's a struggle sometimes, but we want to strive to do that and, and continue that. This is at one of the local churches. This is a church we cook at the hot meals. They cook for us. So that we're partnered with the church. We provide the food. They cook the meals. And it's a win-win situation because they're doing community service in their area. And we're getting the food, hot meal, for our community.
Oh, that's great.
And, the truck is it draws people in because when they see that, and I want to make sure that when they see the truck, it symbolizes hope.
Right. Oh, that's great.
And that's what I put on there. Help other people eat. And, I saw that online. I'm not going to take credit for it, but it resonated so much with me that I said, that's what we do, give people hope. We help them eat, but yet they have hope for at least a couple of meals. And, that's one of the things we have to do, work as a community because we do. It's a lot. And the more you give, the more, like I say, to whom much is given, much is required. When you give, it's going to be more people coming. So we have to work together. We do. Okay, then. Well, I have another question for you.
Hey, I know you well, let's see if I do, how I do with this. I'm 50-50 right now.
Yeah, we're going to break it. All right. Now, my third question is, which of the following is the best example of prescribing food as medicine?
Okay.
A, prescribing physical therapy and vitamins. B, giving produce vouchers to patients with diabetes. C, encouraging patients to eat out less often, or D, offering patients a calorie tracking app.
Well, those are all good ideas. I'm going to go B.
No, wow, you know something.
I do. Was hoping I might.
Okay.
But see, they're all good ideas. I know a little bit about a food as medicine program because there's one at the university where in the department that I work.
Wow.
So I had an unfair advantage maybe with that one.
Well, but that's good because it let people know. And even in our community, we have for the seniors basically, they have a voucher program, the farmers market,
Right.
and it helps. And he say food is medicine. Food is not a luxury; it's a form of medicine. Like,
It is life.
yeah, now we're right. And clients who receive regular nutrient-rich foods have fewer symptoms, fewer problems, fewer medical conditions. And then they can, if they have those medical conditions prior to eating right, it will help control it. And even, they can one day hopefully reverse it.
Pandora, what's going to be difficult is that there will be people who sit for this master class and they're going to hear you talking about hunger and people who don't have food. And that is such a foreign concept to them because they have never gone without food and they've never experienced a lack of access to healthy food. And so it's very difficult sometimes to help people understand the life experience of other people who are our neighbors, right?
Yes, right. That is so true.
Mm-hmm. Yeah. No, but I don't know if you could give somebody a homework assignment. If you've never been hungry or if you've never had to live on a fixed income, maybe an assignment could be something like set aside 1 week. And for students, find a week when there are no exams. Maybe this is a week when it's more quiet. Okay, maybe it's a week when you go home.
Yeah.
Set aside 1 week and determine that you are going to live on no more than, and this is generous, $5 a day. $5 a day. And limit your food intake to what would be only $5 a day. And healthy food. We're not saying, ramen noodles that you can get a package in, for less than $1. We're saying healthy food. So if you want to understand some of what Pandora is talking about, and you've never had hunger as an experience, this would be a suggestion of something you could try.
Oh, that's
You can share that. And $5 is generous because
right. And now with the prices today, and that's for some people, like you said, that's generous. And also to add to that, a salmon, I just the first night go to bed,
well, that hungry.
and it wakes up and don't eat until noon. If you could do that, because some people don't eat at all for days.
Right. I think all of us who want to be in healthcare, whether we are currently practitioners or we are students studying, I know as a registered dietitian and nutritionist that I used to challenge myself to try all the different nutrition supplements so that I would know what they taste like. If I'm going to ask a patient to drink this to improve their health, a high protein supplement or whatever it was, I needed to know what that was like.
Yes.
I would also eat a meal with whatever modification, or it was low sodium. The hardest ones were those that were mechanically ground because they're almost like liquid. But again, if I'm asking another person to do this, then I should have some of that experience myself. So I think your idea to go to bed hungry and not eat until noon is an excellent one. Yes. It's a good learning opportunity.
Some of us have never, some of you students might have never heard your stomach growl. But, in classrooms, especially kids come to school already. I say until 12 because when those kids go to bed at night, they don't have any,
Right.
They don't get it until lunch the next day. But that's why I want to ask, or even professional, just try it and see, because it's painful for one and it hurts.
It does.
But I thank you for that. That was a great assignment.
Thank you.
It really was.
It's a meaningful one.
It is. I do have more pictures of healthy food. We do have some processed foods in the cans, but most of them are vegetables. peanut butter, things like that, brown rice. Uh, and also we are partnered with Feeding America and Walmart, Kroger. They're really good, Dollar General, about giving us great fresh fruit, vegetable.
Right. Those are great partners.
Yes, they really
For
are.
every community.
Yes. So they really stand up for the community. And we get things that the clients could not afford to buy, even if they had a regular paying job. They give the quality of food. And our clients are really pleased with it. And it make them feel special. Right. Because we have the dignity of, when they get food, we don't want to give them something that's not good, like, or make them feel less than, when we serve and treat them like they're at a restaurant. I always give them more because if they don't eat it all, they'll have some for later. Right. So this is one of our partners. And also I didn't mention, but I would like to give a shout out to Mars Food and also to Molina Healthcare. They're the ones that really donated the trucks, the food pantry truck.
Oh, that's great.
And they did it back in 22, I think it was. Right, after the pandemic, we started selling now.
Right.
And they helped us to bring more food to the Delta. Right. In surrounding areas, because we didn't leave our neighbors out. We shared. Okay. More of our partners are Aim for Change. They have really played a phenomenal part. Right. What we do. They one of the first ones to help us with our commercial freezer refrigerator stove. And we were able to, because I burnt up 3 stoves cooking. Oh my good, regular stoves. Oh my goodness. Yeah,
Cooking for a group is very different than cooking for a family or yourself, right?
And they've helped us to get a commercial stove that really, did its job. So I want to give them a shout out and show them. Also, while we're talking about partners, we have public schools, then we have our private schools. We have a good community in Greenville.
Oh, that's
I mean, when we call, they always answer. And it's not the same people all the time. Everybody wants to give. They don't wait until just the holiday. Holidays, you do have an overflow. But every day, if I call or say we're doing something,
right.
Next thing I know, they would drive up or 5 minutes call. So just getting the community involved. As students especially, or clinicians or anything, you can always reach out on Facebook. Right. And that's how we first started getting people to understand what we were doing. Right. Hearing a food pack is one thing, but seeing what you do is nothing like the visual of anything.
And that's what I love throughout this presentation. This is important for everyone who's joining us online to know. You have pictures of your program in action. This is not art that you have taken from the internet or downloaded from, Google sites or something. This is your program at work in the community.
Yes, ma'am. It is. Like I said, I love our community. They reach out, they give, they support. And that's what and the way you can connect with your community, let them know what you're doing. Right. Post it, put it on Facebook. And they want to see the baby. I've had babies come up thanking me and hugging me for the meal of a pack of noodles. That's how important food is.
It is.
Hey, I hope I'm not going too fast.
Are you going fine?
And I did say churches. We have churches, all types of churches that would always help give. They would deliver food. They would have the community gardens. That's a big thing. That helps a lot. And they would bring the produce in or the harvest in and donate it to the pantry. So that's another form of getting fresh fruit and vegetables.
I love how you pull different sectors of the community together. I don't know if you work with the business sector, Chamber of Commerce. You might have some folks in the chamber that, gosh, they never thought about volunteering and being part of a food pantry. And it would just open their understanding to the needs in the community that they have a business in. And also, hey, open some opportunities for some new relationships,
That's
right?
so true. That's true. And at the time I was not with the chamber. And I didn't mention this earlier, but I started with the for-profit business, which really turned everything, because I was paying for everything out of my pocket and just giving, doing, because I saw the need and the Lord put it in my heart and gave the finances to start it. But once it built momentum, and people started noticing, our local Salvation Army closed. They closed without warning, without notice. And then we had to step up to the plate because no one in the community was doing it on the capacity. Right? So the Lord blessed where we could continue doing what we were doing. And people saw it, they're like, let us keep.
Wow.
And it was a big help.
See, it's once you let the need be known, it's surprising who might show up. It might be you don't expect.
That is so true. And that has happened.
But you got to give the opportunity. And that's what you do when you get the word out.
That's right. So I thank God for that. And then I want to just shout out to our partners or other partners in the business sector. We had Dollar General.
Oh, God.
As a mayor, the city of Greenville, they participated and supported us with the Mayor Food Corps. And of course, the Walmart. And we are, surprisingly to me, the Delta News, our local news station, partnered with Jax. Jax was looking to work with an organization that fed. And around Christmas, they did a food donation for us. And it was big, it was advertising and food. So it was a big blessing that they chose us to partner tonight. And, we serve all types of nationalities, wherever come through. We have people just traveling through the town and they will see the news and they stop by to get what they could.
Wow.
So we're here. We try not to turn anybody down. We have, but we're going to try to give it out. And we also partner with Extra Table. They're out of the coast from Hattiesburg. They will come once a month. They deliver. They've been doing this since at least 10 years or more.
Wow.
And because the local casino, Trop Casino, they send muscle out. So they send volunteers. They have a team called Heroes. And they always flexing those muscles and willing to move and give and bag groceries. So they really was a big help because when my husband initially fell sick, it was the community that helped work. And also we have to beyond it's the military.
Oh, wow.
The founder of this organization was in the military. He wanted to give back to help the veterans because nobody was really doing anything for the veterans.
Right.
So he started and it picked up, but we partnered on a couple of occasions and it just worked out. We gave and they gave. And like I said, I definitely don't want to leave out Mars Food for that truck and Malena Healthcare and also our local Kroger organization.
That's great.
And one thing we talked about was utility. When I found out that our elderly clients especially they had to choose between medication, food, and the bills we provide. We partner with Entity, and we help pay light bills.
Oh, that's great.
$300 a year for the still. It might pay 2 or 3 bills a month.
But that's 2 or 3 people.
Yeah, that's right. So we've done that. So it just in a way we can. We've tried to help. Like I said, my heart is with the elderly and disabled. So we do everything we can. Sure, families, but especially the elderly and disabled. Now that we've gone through 3 questions, I do have a little one. Of which age group is often overlooked the home relief effort? It's children, adults, senior citizens, or teenagers.
I'm going to choose what seems least likely, but probably is the answer. Senior citizens?
So isn't yes, ma'am. Because seniors, especially those living on fixed income, face hidden hunger. I kept bringing up about seniors. Look, they are the ones people overlook, even with the SNAP program. The seniors, some of us getting $13 a month, $25 a month. And they really were on the feet. And I never could understand why. I don't know what it is now. But initially when I started helping and really focusing on the seniors, they were really wasn't getting anything that they could really do anything with. So the senior citizens are really the group because they've served their time in the community, and now they just seem like they've been thrown to the side and they live on a fixed income. So when most of the seniors are the ones that are going to the doctor, most young people, if they're sick, they're not going to go to the doctor like that. So there's one thing, the students, clinicians, anybody, when you run into the seniors, those are the ones that really need our help just as much as the children, sure. But, it's just a blessing that, we could see and do things that they, to help them, things that they needed. Right. Okay, I want to just share this. Food insecurity among homebound and elderly and disabled. It's on a national snapshot. Nationwide, 1 in 6 seniors live with food insecurity. A study of low-income older adults found 23% of individuals aged 65 and plus had experienced food insecurity. Among seniors aged 70 to 74, the rate increased to approximately 26%.
Oh my goodness.
And this young lady is my 80-year-old mother, and she will help us fix meals for her. Elderly and disabled. She's elderly, but you can't tell her to. I wouldn't try. No, I wouldn't be disrespectful. No, but she loves to cook, and they really enjoyed it. And this is the plate to the right is some of the meals we give out.
Wow.
And like I said, we believe in maintaining dignity, make them proud of getting right, not feeling like they just getting something right or anything. So whenever you're doing something for someone, give your best. If someone comes into the clinic or into a office, especially a senior, right, let them know that they're you're just concerned about their well-being as you would someone else. So I have pictures of some of our homebound clients, racial mobility status. Homebound elderly, many rely on home delivered meals, like Meals on Wheels and community pantry program, while exact county level data is limited. National trends suggest home delivered meals recipients typically reflect or exceed general senior hunger rates at more than or equal to 17%. And, that's a lot. Homebound that don't have mobility.
Right.
With the mobile scenes, those that can get around, those who can travel to pantries or pickups, sites face barriers because 1 in 4 Delta seniors I know still struggle with food insecurity, regardless of mobility. And that is one of the things. They don't have transportation. They have to pay to even come and pick up a meal.
Right.
And these meals are important because those are the ones suffering with those chronic illnesses that can be managed better by food. So they have to struggle to get to a site or, to receive it.
Right.
And if you can see in the far right, this is the line. It went all the way around the corner.
Oh my.
You can barely see it, but it was so many people that usually when we give out, we have at least 200 people at one time.
Wow.
150 to 200. Those in the car. But family served, it might be 2 or 3 people in the car. So we have to, try to help them share. Senior group estimate rate of food insecurity. All seniors 65 plus is equal to about 23%. Homebound seniors, more or less 23%, likely higher.
Right.
Those that are mobile and can get out is just as bad as those that are homebound at a 23%. And we say that at least 1 in 4 Deltas face food insecurity. I would say it's higher. I would say half, because half the people half the people you see are hungry.
Right.
They don't have. And sometimes most people, they would see me in the store, and when they see me, they see food. Right. But they were always, and I had started going around carrying food in my car. Canned goods, yes, but it's something.
Right.
But we would do a pop-up at any given time with fresh fruit and vegetables. When we get them, and people just start pulling up. So it's a need.
Right.
And, it really, my heart is overfull because just to see it, and I cannot explain it, would do justice to what it's actually like.
Right.
I have another poll question for you, young lady. All right. And this is the final one. I know where. Now, let me ask you this. Out of everything we've talked about and what the students or
Could be the professionals, other nurses, doctors.
anybody that deal with a group of people, which action is most effective for influencing food policies in underserved areas? Is it A, attending a cooking class? B, voting only in presidential election? C, building relationships with local legislators, sharing community stories? Or D, waiting for federal reform to occur?
I know this because I came to master class number 3. So I know it's all about building those relationships with your elected and appointed officials. And as they're the ones making decisions, that send the money and send the resources into our communities, right?
Well, I'm gonna wait before I answer them. All right. I heard of the get girl, we're gonna see. You've been pretty good. I want to go, but at least I want to wait because I want to share that I did have a chance. My husband and I, we had a chance to go to our local, and you mentioned it at the beginning in series that we had a chance to go to the local fight reform and public hearing. And we were invited by one of the people. We were doing so much, and they called and invited us to come. And I had the opportunity to speak to the whole.
Listen to it?
Yes. Oh my goodness, they listened. That's the thing. They listened. They tried to do. I didn't see any immediate, but some of the people that were there speaking on behalf of whatever issue they were having, they came up to me afterwards and was willing to support what we were doing. So policy reform is good because one of the excuse me, but let me pause on that. One of the state representatives is a part of our board. So he's an attorney and he's been with us even from the beginning. How great. So I have his ear. And then we have one of the congressmen he's a local young man, and the mayor is his brother. So well, there you go. Yeah, so all I have to do is just let it be known. They know the work that we're doing, right? And then they're working. Not just the help of the pantry, but with the people. Like their second thing is for the people.
And see what you just said, though, you know them. So see, it's all about those relationships.
That is so true. That's so true. And so that's the answer. Well, before I move on, I want to just read this a little bit.
Okay.
Structured policy and legislative advocacy. And that's what we're doing, advocating for our people.
It's just telling the story. Yeah, it's all it is. They have to be any more fancy than that is. And they're big.
And, structured problems demand structured solutions. Policies are more powerful when they are personal. Yeah, and that's really close to my heart as many other people. Your voice as a professional carries influence. Use it for systemic justice. That's what it is, justice. The courtroom of life, helping. So I thank for that. And yes, ma'am, you are so correct. See, I learned from the master because it was right before yours. So the information's fresh in my mind, right? That's a blessing. And it is building on relationships. You were local, right? And sharing your story. Community story.
Yeah, exactly.
So that's what we can do to just keep your name out there with the public. When people come to you, you should see them as, okay, you should take it personal, I would say. This is my chance to help. This is my opportunity to show a lead. And they're people in the community, or they trust people that are in authority or have influence as far as their health or social workers or anything. So that's the main thing. Just people that they trust you just because, like, you're holding a title or you can help and do. And am I on the right? Yes, ma'am.
And when you are a physician, or you are a nurse, or you are a pharmacist, you have gone through the education, you have gone through the clinical training. So not only do you have the knowledge, but you have the skills to really make a difference for somebody.
That's right. And that's what they do. And you know what, in the Delta, I know a lot of people they're I would say illiterate, but they can't comprehend writing. And they need people that they can trust to lead them the right way. And some of them you can't. I know my great grandmother, if the doctor told her something, she was going to do right. If she went to where someone, like you said, was trained or educated in the field and they coach, she would try her best to do it. Right. And so a lot of people are influenced by it's because you are who you are. Right. So that's a bliss. All right. Now I have a call to action. All right. Those of you that have been listening attentively, if you have questions or anything, this is your moment to lead, not just in your profession, but in your community. Whether you are in medicine and athletics, nursing, or public health, together we can nourish the body, defend dignity, and regime what healthy looks like. Oh, a regimen, Lord. Cut that out. Let me see. Together we can nourish the body, defend dignity, and regimen what it's right. Regimen. I'm not looking. Oh, Lord. Well, how do you spell it? REIMAGINE. Reimagine. Oh, Lord, I need to quit. You didn't start. Is it on? You caught it. Don't worry. I was here. You can do it. Go ahead. I can't read it. Yeah, it's all right. Oh, and together we can nourish the body, defend dignity, and reimagine what healthy looks like for generations to come. We can. Yes. And together, that's what it said. Together we can. Because when you go, when I've gone as far as I can and I hand it over to you, you can take it to test. Yes, that fine. And they will take us far.
Right. Absolutely. There is an African proverb that I love and that I hear often cited in my community. If you want to go fast, go alone. If you want to go farther, go with a group.
Oh, wow. That is awesome.
I think you need to adopt that or with hearty helpings because you're not going fast by yourself. You want to go the distance, right? And so you're taking a team.
Yes, no, that is so, I love it. It is so, and that is so true. And, sometimes, when the Lord blessed us to start this, I was just looking at the now. I wasn't looking at the future.
Right.
And that's why I wanted the future, because with the health clinicians, students, teachers, they're our future. They're touching the future. When they come in the clinic. So we can't see the future now, but we know that there's a future out there. So it's our time now to plant that seed, and it'll grow into, with everybody planting, constantly watering the seed. And that's in the Bible. Yes, that's it. So.
And Ms. Pandora, I'm just so grateful for your time and all the information that you shared. I know the next generation of health providers that's listening and participating in our master classes have some food for thought, right? And they are the next generation. So you've given them some ideas that they'll be able to implement, as they finish school and eventually enter practice.
Well, thank you so much, Ms. Gaia. I really enjoyed it. And I hope that I could just have planted a seed in somebody's heart to do what was already in there. I hope I stirred it up, and they're prepared to move forward and they've been called to action. Now we just have to
be faithful and positive.
That's right. That's right. That's right.
Well, I'm going to go ahead then and close this master class, everybody, and we have finished with Ms. Pandora Redmond's master class, and I hope that you're going to look forward to joining us for master class number 5. Which is reading between the lines, addressing literacy to improve health outcomes. So you were talking about your great-grandmother who may not have great reading skills. And so here we're going to hear from the experts with our next master class, what to look for to identify those signs of low literacy, what is that relationship between literacy and ability to manage health. So looking forward to seeing all of you in class number 5, and this class is dismissed.